Hey everyone, I wanted to talk about a phenomenon that we see after hair transplant that sometimes worries people, but it's totally normal. This phenomenon is that the grafts that we put in look like they're falling out. Now, what does that mean? I mean, we just transplanted the hairs. Why would they fall out? Great, let me explain. When we transplant hair follicles, there's a couple of parts that come in. One is the follicle or the follicular unit that's under the skin, and the other one is the hair shaft, which is the part that we see that comes coming out of the skin. The follicular unit stays in after about 10 days, has a blood supply, and it won't go anywhere. That's where it is. It's going to survive. The shaft, on the other hand, is generally released by the follicular unit, and after the first few weeks to first month, it tends to fall out. Which means that when we first transplant, there's all these little hairs that are out there, and everybody looks at it and says, great, I got a lot of density. A month later, they're all out, and everybody worries. But don't worry, that shaft was going to fall out because those hair follicles need to regrow new hair shafts in order to grow the hair out. Those follicles stay in the skin, they won't go anywhere, and they'll grow, so don't worry about it. It's something that's totally normal. See it all the time, and in fact, this is part of what we tell patients to see. The first few weeks, you'll notice hairs falling out. After that, nothing happens. After the first 3 or 4 months, you start noticing little hairs coming out. By 1 year, that's when you see your full density.